Mr. President, I am also very proud to be here with my colleagues. I think Senator Murray was eloquent, Senator Shaheen, Senator Mikulski, and I'm here to put it in my own words. And that is, here they go again. Sadly, politics has once again entered into women's health care. This time, we see an attempt to deprive women of a critical benefit, access to contraception, through their health insurance plans. Just last week, what did we see? A move to punish women by taking away their free breast cancer screenings, all because of right-wing politics. Before that, as Senator Murray eloquently indicated, we saw a Republican move to defund family planning because of politics. My Republican colleagues almost shut down the government over family planning. And now, if they have their way, millions of women could lose their contraceptive coverage, which could expose them to declining health outcomes and their babies to declining health outcomes, and could cost them about $600 a year. Let's step back and look at where we are. Some months ago, the Institute of Medicine, which is a number of leading scientific and health experts, made a decision. They advised the Obama administration on what preventive benefits should be included for women, specifically for women, in new health insurance plans. That's what this whole to-do is all about. This organization that has nothing to do with politics and everything to do with health care made a very clear recommendation to the Obama administration. They said there's a number of preventive benefits that should be included for free for women of this country. Screening for gestational diabetes, HIV screening, cervical cancer prevention, annual well women visits, and access to contraception. And now, just as these women, our women of this nation, are ready for these preventive services, services they need, services most of them want, my Republican friends, from presidential candidates Romney to Newt Gingrich to the Senate and House Republican leaders, I heard Senator McConnell threaten legislation to take away these benefits, to Speaker Boehner, to individual Republicans in both houses, they're gearing up to repeal one of these benefits: access to birth control. Access to birth control. Now, I believe women in this country deserve respect. Some of them don't want access to birth control. They have a religion that dictates their views, and they have every right to make that decision. And others decide that they need to have access to birth control. So the Obama administration says to the women of this great nation, they believe there ought to be access. But I think it's very important. The Institute of Medicine said no exception. They think access to contraception is so important to women's health, they didn't want any exception. But the Obama administration made an exception for churches, for religious institutions. And under the Obama administration's rule, 335,000 religious organizations will not have to offer birth control if they have a conscience reason not to do so. That is a compromise. Remember, the health experts said no exception. The Obama administration said, well, I want to respect the religious institutions, and so I will allow them, if their mission is religious and the people they serve are basically of one religion, and the employees that they hire, they're a religious institution, they will not have to offer contraception in the health care benefits to their employees. But guess what? There's another part of this equation. Women, they have to have their religious beliefs respected. And that is why the president also said, if you run an organization that serves a diverse number of people from different religions and so on and different beliefs, let them have the right to make that decision if they want to obtain free birth control through their insurance. Now, here's the thing, Mr. President, this outcry is astonishing to me. Since 28 states already assure access to birth control, I have never heard any of my colleagues, maybe they did come on the floor and complain, but more than half of our women, over 28 states, more than half of women have access to birth control. So this isn't some new benefit. This is just making sure that all women, except that very narrow band that work for strictly religious institutions, have the right to have access to free birth control. And the outcry is unbelievable. A political outcry making this a political issue when it is a medical issue. President compromised. He said, you're strictly a religious institution. You don't have to do this if you don't want to. Now, here's the other thing. All organizations that have any religious issue have an extra year to determine if they're going to offer this or how they can do it. They may be able to find a way in that year to get women access and at the same time not violate their conscience. They have an extra year to do that. But oh no, we're going to see legislation, I could assure you, we're going to see legislation to overturn this, legislation that even goes further than this, and it's going to be a battle here on the floor of the Senate, I'm afraid. I'm not afraid of the fight. I welcome it. Because let's be clear, virtually all women have used birth control at some point in their lives. Let me repeat this. Virtually all women have used birth control at some point in their lives, including 98% of Catholic women. That's the fact. And 71% of American voters, including 77% of Catholic women voters, support the administration's policy. So if my colleagues decide they're going to take this issue on in the face of overwhelming support for this policy by the American people, I say we're ready. We're ready to make the case. Access to birth control is directly linked to maternal and infant health. This isn't some theoretical right. It's a right that is necessary. Health experts tell us that women with unintended pregnancies are less likely to get prenatal care in the first trimester, and in some cases, they never get it. And Mr. President, if there is one thing that should unite us, it's healthy babies, healthy outcomes from healthy pregnancies. And that's what we're talking about. So, I want to talk about something else we don't hear enough of. And I want to compliment Senator Gillibrand on this because she's the one who brought this issue to my attention. A full 14% of women who use birth control pills, that's over 1.5 million women, use them to treat serious medical conditions, Mr. President, not to prevent pregnancies. What are those conditions? Debilitating monthly pain, irregular cycles, conditions like endometriosis, serious skin conditions. I just learned of a young woman at Georgetown University did not offer this free insurance policy regarding birth control. Her doctor told her she had a serious medical condition and she needed to use birth control pills. It had nothing to do with pregnancies or anything else or preventing pregnancies. It was serious medical condition. And the diagnosis was, I may not say it right, polycystic ovary syndrome. Now, what happened is She was told, you must go on birth control pills, but we at Georgetown, we won't pay for that benefit. She had to go out and do it. It was more than $100 a month, and she couldn't afford it. Within months, she developed a large ovarian cyst that had to be removed surgically. And in addition, she lost an ovary. So please don't stand here and tell us that women don't need access to birth control pills or contraception, because we have story after story after story. And let me tell you something else, Mr. President, some folks may not know. And that is that in many occasions, when a woman wants to become pregnant and has irregular cycles and can't, she will be put on the birth control pill. And a British scientific study came out and showed that after 5 years on birth control pills, women who had this problem were able to become pregnant and become mothers. So this isn't some simple pat statement. This is about making sure that the women of this country, the young women, the middle-aged women of childbearing age, and older women who have other conditions, get the medicines that they need. And by the way, get them for free. $600 a year for many middle-class and working poor women is just out of reach, out of reach. So I say to my Republican friends who came to the floor previous to our statements, don't punish women again. Don't try to. Under the administration plan, churches are respected and women are respected. All sides are respected. No one is forced to use birth control. It is up to the woman. 28 states, more than 50% of the women already have this benefit. Why are you bringing politics into this? My Republican friends want to turn back the clock on birth control. Some of us remember the days when birth control was illegal. Well, I have news for them. This is the 21st century. Wake up. Look at your calendar. It's the 21st century. And women ought to be respected, and women ought to be trusted, and their families ought to be trusted and respected. And we are not going quietly into the night on this one. We will be here. We will fight back. We will fight for women and their families and health care. And we will fight to keep politics out of the equation. Thank you very much. I yield the floor.